Sorry, for the coordinating Minister of Health and Social Welfare, Professor Mohammed Pate, it was a rude awakening of sorts at the 13th Biennial Delegates meeting of the Scientific Conference of the Medical and Dental Consultants Association of Nigeria, held in Kano. Now, the minister, represented by the Chief Medical Director of the Aminu Kano Teaching Hospital, Professor Abdulrahman Abba Sheshe, lamented the deplorable state of the health sector of our country. To him, funding and brain drain are the two major factors responsible for the morass in the sector. Now that we know the problem, shall we go and work on it? We now know the problem.
Yeah. Yes, we know the problem. But this problem is not something that's new. It's not like when you say you are setting up a committee, to identify certain problems. We have always known these problems are there. So the minister has just stated what we've always known, that we have had problems in the health sector, and this problem could be attributed to the brain drain, poor facilities, and even
poor funding.
Poor funding, and even the attitude of some of the practitioners in that
attitude
sector.
To work.
Yeah, exactly. Because from the experience I've had, especially in the general hospitals and all those things, you see, it's like these people don't really understand the essence of life, what is supposed to be important to them, and that is to save lives. And the attitude, the way they treat patients. There was an accident that happened some years back. A colleague of ours had an accident at the airport. He was a journalist too. Yeah. We took him to the general hospital in Ikeja. It was there. The accident happened in the evening, around 4 p.m. We were there throughout the night with him. They were taking care of him. In a developed country, a man that survived more than 24 hours is not supposed to die again.
Yeah.
But since I would die about 24 hours later.
Care was no longer
there. Because there was negligence. Yeah. And what happened? We were very angry. We did a petition, and the government said they were going to institute a probe, which they did. But at the end of it, nothing came out of it. People are not punished. Once people do things and they are not punished for the crime, there's going to be a problem in the country, and this is the problem they're going to be having. So the minister has identified some of this problem. Then he should tell us the way forward on it.
That's it. Inka, they say not today. We've been there before.
Yes. I remember very clearly the former First Lady, Mrs. Aisha Buhari, once went to the presidential, what do they call it now? The Aso Rock Clinic.
Yeah.
And she was alarmed that there were no medications, no medicine, no this, no that. She even specifically said, not even Panadol. And then you ask yourself, the money that has been voted for this,
what happened to it?
President, what happened to it? I want to see a situation where the president of Nigeria, or the governor of a state will have any ailment and will not go abroad and insist that it must be treated in the facilities. Yeah. We are all aware, or we are all living witnesses to a governor in the South region, I won't mention his name, who said he has built a world-class hospital. Shortly after that, he went to Abuja and he had an accident. Lo and behold, where did they fly him to? He was flown abroad. Why not to the facility that he claimed is world-class?
If you ask me, now who I go ask?
So the truth of the matter is that we must move this thing forward.
Inka, sometimes you ask yourself, the officers of state know where the problem is and the possible answers, but they pussyfoot or they won't do anything at all. You wonder if it is not deliberate.
Well, you see, some of these things are deliberate. And also, we also have to blame ourselves.
Who are these us?
Each and every one of us as Nigerians.
Okay.
Let me give you an example. I think about 2 months now or so, I went to Orile Agege General Hospital. The facilities there and the workforce that I saw, I was impressed. The atmosphere neat, good, and the way the workers relate with you. I mean, I was asking myself, is this Nigeria? That is one. But go to another.
You were not watching a film.
No, I wasn't watching a film. I even put it on the social media to say that. But somebody who was said that, okay, maybe because they've seen me on TV and so on. I said, no. Most of those who were attended to before me and even after me, it was the same kind of courtesy that I saw. I think the medical director in that Orile Agege Hospital deserves the praise. Now, but go to another clinic or to another.
Well, let me take Lagos State.
Lagos State has
They are doing very well. They are doing very well.
And that's where I'm going, that sometimes we will have to blame ourselves. You see, the governor or the commissioner for health or the minister of health cannot be everywhere. The truth of the matter is that those who are put in charge must be ready to make sure that they discipline their workforce. Because when you don't do that, look, everybody like to the easy way out. Yeah. People like to come to the office, sit down the whole day. After the end of the day, they go home. And when the salary is delayed, they complain. They will not think of how they have shortchanged the system. So what are we saying now? The minister has seen where the problem lies. It is now left for him. Because it is not only to say that we put money, we put 24 billion in the health system. The question is, where is that 24 billion? How does it go? We must follow the trail of this money.
Which is saying, Bolaji, it can be done.
It can be done. Look, they did something in Lagos State. I could remember, was it Fashola that was the governor then? That when he built this Ikeja General Hospital, you had maybe he needed to do some checkups. He went there to do it. I could remember that time. Lagos State, you have to give it to them. They are really doing very well. Although they are, but in every situation, you always find the odd ones.
Black sheep.
Yeah. The black sheep. Yeah, exactly. You know, in Nigeria, the health facility has always been a major issue with us. It's always been. And today, when you look at Nigeria, Nigeria has the second highest maternal mortality rate globally. Yeah. Globally, it is quite unfortunate. When things that people are not supposed to be dying for, that people are dying for. Women, maybe they have eclampsia, hypertension.
Bolaji, now we are retooling our country. Yeah. So the health sector must be a part of the...
It should be. It should be. Everywhere, not only the health sector, every part of this society, of our society. Because we kept complaining. We also have to ask, like Yinka said, what are we doing as citizens? What are we doing? Are we really following the trend of making this country a better place for every one of us? No, because there are certain things that we do personally in our own little corner that is detrimental to what we are also talking about.
Okay. We always blame others, but we don't blame ourselves.
Exactly.
Yeah. That's the thing. I live here now, I see traffic ahead, I veer off and drive one way, and then I'll be blaming every other person and government. That is the problem. Because we must all do our own part.
And leave the rest.
If the government is not doing its own part, let us point it out. And then in our own little corner, let us keep our house clean so that we will be able to know that this problem is not arising from me. I've done my own part. It's left for the government to do its own part.
All right. Well, the Honorable Minister has just taken office. This is not a dash, it's a marathon.
It is a 4-year race. And you see, one thing I like very much about this, especially the Minister of Health, is a man I've followed his career. He is a very, very diligent man when it comes to the health. You know, he was Minister of State for Health at one time. And so he's coming back this time, I believe, is to, you know, when you are on the driver's seat.
Rather reminds me of Professor Jibril
Aminu. Yeah. When you are on the driver's seat, exactly. When you are on the driver's seat, you can direct what goes on. So the man has had his field now as the Minister of Health. So all the experiences he has garnered from his international appointment, and He was supposed to get something higher before he was named a minister, and he decided to come back home to give back and also help to retool the system. I believe very strongly that he is going to make a change. We are going to remember him as we keep remembering Professor Olukoya.
Okay. So to you, Professor Mohammed Ali Pate, we wish you Godspeed.